here. Today we are exploring a personality disorder that often goes unnoticed, dependent personality disorder or DPD. DPD stands for dependent personality disorder for short. So we will break down what DPD is, the case, sign, real life examples, diagnosis, treatment, and how to support someone who may have it. So we can discuss about TBD. So let's begin. What is dependent personality disorder? Dependent personality disorder is a mental health condition where a person feels extremely dependent on others to meet their emotional and decision making needs. They fear being left alone and often go to great lengths to please others even when it's hurt them. It is part of the cluster C personality disorder in the DSM-5, which we characterize by anxiety and fearfulness. Example of dependent personality disorder. Ali, a 20-year-old man, cannot decide what to wear, what job to take, or even what to eat. Unless someone else decides for him, he consistently seeks reassurance from his parents or girlfriend. He fears that if he disagrees, they will leave him. So, according to DSM-5, is diagnosed when at least of the five symptoms following eight symptoms are present. Difficulty making everyday decision without advice. Examples: asking three people if it is okay wear blue clothes to a party. Second number, need other to take responsibility for most areas of life. Examples: letting parents choose their jobs, friends, and life partner. Number three, fear of disagreeing due to fear of losing support. Examples: staying silent in argument to avoid conflict. Number four, difficulty starting tasks alone due to lack of confidence. Example: cannot start college assignment without someone sitting beside. Number five, goes to excessive length to gain approval or support. Example: doing something dirty, laundry, or unethical task just to stay liked. Number six, feel uncomfortable or helpless when alone. Examples: panic attack when friends are not available. Number seven, immediately seeks another relationship when one needs. Examples: quickly dating someone new after a breakup. Unrealistic for fear of being left to care for one's. Examples: believing that can survive alone. So, cases of dependent personality disorder. Let's explore why some people develop DPD. Biological factor, family history of anxiety or personality disorder. Neurochemical imbalance, low serotonin. Serotonin is a chemical. Psychodynamic therapy theory. Freud believed overprotective parenting during the oral stage of development can cause dependence. Child may grow up feeling helpless without parental guidance. Behavior cognitive therapy theory. Learned behavior, children learn that being passing lead to reward, belief them system: I am weak or I cannot survive alone. Social environment factor, over controlling or neglecting parent, trauma or illness in childhood that made them dependent on others. Cultural or religion norms that promote obedience or submission. Example: a boy raised by an overall strict and controlling father was never allowed to make decisions. As an adult, he feels lost without someone telling him what to do. Impact on daily life of DPD. DPD affect all areas of life, relationship, work, education and mental health. In relation, they become clingy, jealous or tolerate abuse. In jobs, they avoid leadership, fear criticism and cannot work independently. Emotionally, they may suffer from depression or anxiety due to constant self-doubt. Socially, they avoid decisions or situations that require independence. Example, Shahid refused a job after because he could not move out of his parents' home. He feared being alone in another city. So diagnosis by mental health professionals using DSM-5 criteria, usually being in early adulthood. Tools like clinical interviews, personality inventory, psychological assessment are used. Important to rule out other disorder like borderline personality disorder or anxiety disorder. Treatment of TBD. Treatment can help the person build confidence, independence, and healthy boundaries. Cognitive behavior therapy CBT change negative thinking pattern like I cannot do anything alone. Builds confidence and independence. Help them say no and express opinion. Medication used only if anxiety or depression is present. So, group therapy help practice independent in a safe environment. Family therapy reduce unhealthy dependent on family members. Example 5 in therapy, Aisha learned how to say no to unreasoned requests from her partner. She being making decisions like grocery shopping or choosing our clothes without asking other. So, how to help someone with DPD? By supportive but don't make decision for them. Encourage them to try small independent tasks, reinforce their self-worth. Recommended professional help. Avoid being controlling even with good intention. So, related condition DPD may co-occur with depression, generalized anxiety disorder, borderline personality disorder, avoidant personality disorder. Differentiate is important for proper treatment. Dependent personality disorder is a serious yet treatable condition with support and therapy. People with DPD can become more confident, independent, and lead a healthier life. If you are someone you know show these signs, don't hesitate to seek professional help. Thanks for watching.